Numbers can make us numb to what they represent. Every death is someone's parent, someone's partner, someone's child, someone's friend. Our response must be twofold: to mourn those we have lost, and to resolve that each one of us will do everything we can to stop transmission and save lives. Vaccines are giving us hope, which is why every life we lose now is even more tragic. We must take heart, take hope, and take action. I have called for vaccination of health workers and older people to be underway in all countries within the first 100 days of the year. But there is so much we can all do to navigate our way out of this pandemic. While we all wait our turn to be vaccinated, physical distancing, avoiding crowds, masks, hand hygiene, ventilation, and more. You might be sick of hearing it. You might be sick of doing it. But this virus is not sick of us. Please do your part for yourself and for others. As I said, numbers can be dehumanizing. But behind every number is a person, a story. One of the ways WHO is helping to tell stories about health is through the WHO Health for All Film Festival. Last year, almost 1,300 films were submitted from all over the world, telling heartwarming and inspiring stories about health and health workers. This year, we're inviting entries in 3 categories, matching each of WHO's 3 strategic priorities: universal health coverage, health emergencies, and better health and well-being. More details about the categories and the festival are available on our website. As a reminder, the deadline for submitting films for this year's festival is this Saturday, the 30th of January. So get your films in, and I look forward to seeing them. Last week, I said that the world stood on the brink of a catastrophic moral failure if it doesn't deliver equitable access to vaccines. 2 new studies show that it wouldn't just be a moral failure. It would be an economic failure. A new report from the International Labour Organization analyzes the impact of the pandemic on the global labour market. It finds that 8.8% of global working hours were lost last year, resulting in a decline in global labour income equivalent to $3.7 trillion. The report projects that most countries will recover in the second half of 2021, depending on vaccination rollout. It recommends international support for low and middle-income countries to support vaccine rollout and to promote economic and employment recovery. The second study, commissioned by the International Chamber of Commerce Research Foundation, makes a strong economic case for vaccine equity. It finds that vaccine nationalism could cost the global economy up to $9.2 trillion, and almost half of that, $4.5 trillion, would be incurred in the wealthiest economies. In contrast, the financing gap for the access to COVID-19 Tools Accelerator this year is $26 billion. If fully funded, the ACT Accelerator would return up to $166 for every dollar invested. Vaccine nationalism might serve short-term political goals, but it is in every nation's own medium and long-term economic interest to support vaccine equity. Until we end the pandemic everywhere, we won't end it anywhere. As we speak, rich countries are rolling out vaccines while the world's least developed countries watch and wait. Every day that passes, the divide grows larger between the world's haves and have-nots. Less than an hour ago, I spoke to President Ramaphosa of South Africa. And on Wednesday, I will be speaking with ministers of health and ministers of finance from the African Union. I will tell them that we're doing everything we can to accelerate the rollout of vaccines in Africa to save lives and get their economies back on track. The rest of the world must play its part. The COVID-19 pandemic has reminded all of us that health and economics are closely connected and that we're all in this together. We're family. Today, I'm delighted to be joined by the author of this new study, Professor Shabnam Kalamli Arzchan, Professor of Economics at the University of Maryland. Professor, thank you for this important work and thank you for joining us today. You have the floor.
Thank you very much for having me today. This is an amazing honor and privilege to be among such distinguished guests, panelists, and participants. Let me start by saying that this is a study of team of 5. So we are 5 people. I'm just one of the authors. It is joint work with my co-authors, Cem Çakmaklı, Selva Demiral, Sevcan Yeşiltaş, and Muhammed Yıldırım. All right now reside in Turkey, Koç University. There are professors there. And what we did in this paper actually goes back to our conversations in April 2020, when we really want to understand a shock of this magnitude, how will that affect emerging markets and developing economies, since we are all Turkish origin. And that's how we started working on this thing, because we realized for an open economy, for a small open economy, there will be several dimensions of this shock economically, coming from external demand, coming from the imported intermediate inputs, capital flows, exchange rates. So that's how we started working on it. And then later on, we did 2 papers. The latter one is the one we are talking today, thanks to the support by ICC. I will get to the point very quickly. So what we want to do in this paper is to marry the sectoral heterogeneity in infection dynamics with the sectoral heterogeneity in global trade and production network. We know that there is a sectoral heterogeneity on the infection part. The jobs, occupations, sectors where you need close proximity of people are going to have higher infection rates. Old people are going to be more vulnerable. So we already know this thanks to the work by epidemiologists and the like, and also economists, that this is not your standard shock. And certain sectors are going to be way more affected than the other sectors. At the origin, of course, services sectors relative to manufacturing sectors, because services sectors require close proximity. But there is an economic side to this, a global international trade and production network that also works through amazingly complex sectoral linkages. And that's what we want to do. We want to bring that, and then we want to marry these 2 dimensions of the sectoral heterogeneity in infection dynamics and sectoral heterogeneity in trade and production. And that's what we did. We have a SIR model. We borrow that from epidemiologists. We bring very rich data from every country. We do this for 65 countries and 35 sectors. So we have an R number for every country. And then we combine that epidemiological side using real-time data on infection dynamics from WHO, from Johns Hopkins University, combining that with the economic data on trade and production networks. That comes from OECD on multi-country, multi-sector economic linkages. That tells us that how each sector in each country imports and exports with other sectors in other countries. So again, we have a total of 65 countries and 35 sectors. And then we try to estimate several scenarios and several different specifications. The numbers just quoted by Dr. Tedros are our most extreme scenario, like the upper bound estimates, if you like, where we assume there won't be any vaccination at all in emerging markets and developing economies in 2021, where advanced economies are going to be fully vaccinated. I mean, this maybe not that realistic, so we work out other scenarios in the paper too, where there might be some vaccination in emerging market developing economies, still more vaccinations in advanced economies. But the point here is that even you achieve universal vaccination in advanced economies, meaning your restaurants are open, your life back to normal, right? Your services sectors are going to work fine. You are going to have a huge hit in your tradable sector. And then because advanced economies are very large and very connected to global trade and global production networks, they are going to, not only feel this hit, as Dr. Tedros mentioned, they are going to, in the worst case scenario, bear half of this global cost, even they manage to vaccinate all their citizens. And this is very important because this is a full-fledged trade and international production network channel. That's what we want to focus, disconnected from whatever domestic, problems you have in your own country. This is why we work out this case where advanced economies finish the pandemic, they vaccinate everyone, where the other countries not. And this is going to highlight this fact that no economy is an island, right? The economies are interconnected through trade and production linkages. And when we bring them in as they are, we don't also allow any changes to those relationships. We want to estimate this very short-run cost. Then there will be important economic costs, even for the countries who are vaccinated, which would be the advanced economies, which is why we emphasize the economic side of an equitable global vaccine distribution by making sure vaccinations are done also in emerging markets and developing economies so that the global economy can recover as a whole. We say no economy can recover fully until every economy recovers. Thank you very much.
Thank you. Thank you so much, Professor. It's my sincere wish that all governments pay careful attention to this study. The study was commissioned by the Research Foundation of the International Chamber of Commerce, which represents more than 45 million companies in over 100 countries. Today, I'm very pleased to welcome John Denton, the Secretary General of the International Chamber of Commerce. John, you have the floor.
Dr. Tedros, thank you very much. Great to be with you all. It's an honour to participate in this discussion, and it's great to be on the panel, particularly with you, Tedros, but also with one of the analysts who worked so hard on this report. Look, the reason that the ICC is involved is generally driven by our purpose, which is to enable business worldwide to secure peace, prosperity, and opportunity for all. And just as we identified early on the tragedy of the attack, not just on human lives, but also on the economic well-being of so many individuals and citizens on a global basis, We thought at that time to intervene on this crazy issue around the failure of distribution of PEP and ventilators, and we identified there that one of the great risks was that the failure to engage the private sector early on was simply exacerbating the tensions and problems. We actually predicted at that point in time that unless the private sector was more involved, particularly when we saw the issue and the contours start emerging around vaccines and distribution of vaccines, then we were heading towards a problem, a real problem. Our hypothesis was that governments had failed to understand the interconnectedness and in particular, as the previous speaker just said, the impact of trade in goods and services and the interconnectedness of supply chains and the failure of those to continue to operate effectively until all are vaccinated effectively would actually exacerbate the economic damage to the globe. But importantly, that economic damage would not be visited just upon developing countries, but it would actually be effectively visited upon developed countries and economies as well. So the headline number was $9 trillion as economic damage, which would continue to flow unless the COVID-19 vaccines and therapeutics were distributed equitably. But the point which we wanted to understand better, which is clearly made here and has just been identified as well, was that about half of that actually affects developed countries. So if you actually want to actually fix your own economy, you're actually going to have to get involved in fixing the global economy. And part of that is ensuring that global vaccines flow globally and equitably. This is not an act of charity. This is economic common sense. If you want to ensure that the trillions and the hundreds of billions that you are spending on domestic stimulus is actually more than ephemeral, you need to ensure it's durable. It can only be durable if you actually also support access to vaccines and vaccinations and therapeutics in the developing world as well, across the globe, and equitable access there. That's because the failure of exports costs jobs. That's because of a failure to understand that a lot of jobs, for example, in the US, are as a consequence of intermediation of trade, where you get tyres for the auto industry being delivered and developed out of Thailand. And of course, if Thailand can't deliver and develop those tyres into the US market, which causes a slowdown and impairs the auto industry, then there's actually economic loss. And why can't they do that? Because they're being affected by COVID-19 and they're being restricted in their capacity to actually get their factories moving, get their workers to work, which is actually undermining their effectiveness because they can't get access to vaccines and therapeutics. It's in your interests. It's in the interests of finance ministers and governments in developed countries to ensure the equitable access, which is really the full funding of the COVAX Act A facility, which frankly, the shortfall at the moment is 28 billion. When you add up all the stimulus packages, it's less than 1%. It's a rounding error. And this is a very sensible investment. And we already see the contours globally of a K-shaped recovery. And we know that's exacerbating inequality. But do we understand, until we see this report, that we're actually taking those contours and actually making them real and concrete in economies like the US? It's not Wall Street that's going to be affected here. It's Main Street. It's mums and dads. It's actually small, medium enterprises. It's actually workers in service sectors who are actually already hit hard. They're going to be hit even harder again. So frankly, this report is a wake-up call. This is not, and we're sick and tired of hearing governments say, as an act of generosity we're giving to the COVAX facility. Frankly, it's an act of economic rationality to do so. It's incredibly important that we actually understand that there's economic independence and there's mutual interest here in getting this thing right. And there are governments who can do more. We are very happy, and we praised the US government for stepping up and getting involved again. But more needs to be done if they want to ensure that the stimulus package that's working its way through from the White House at the moment and into the US economy is actually effective and durable. They need to get behind and show leadership with other countries. Japan can frankly do more. Canada can do more. Australia can do more. The constituent members of the European Union must do more as well. Wealthy countries, this is not an act of generosity. If you want to ensure a durable recovery in your economies, you need to step up and actually pay up and help here. Because the developed developing world stands ready and willing to actually distribute the vaccines and vaccinations and therapeutics. They simply need access to them, and that's where the ACT-A facilitator comes in. So we welcome the opportunity to participate. The private sector is stepping up, as we have on issues like global mobility, where we not only talked about it, we developed tools like digital authentication to ensure that we can risk manage access to global travel again and get the economies moving, which is why we created ICC AOK Pass. We do practical stuff, we set policy, we set standards. The private sector is committed to enabling business worldwide to secure peace, prosperity and opportunity for all, and this report is an important part of shifting the policy framework to understand that funding COVAX Accelerator A is actually in the mutual interest of all parties, not just developing countries. Developed countries must stand up with the private sector.
Thank you, John. Maybe to quote you, this is not charity, it's an economic common sense. Thank you so much indeed, and thank you for your partnership and support over the past year. With that, Fadila, back to you, and happy birthday again to you and Sophie.
Thank you, Dr. Tedros. I will open now the floor to questions from journalists. I remind you that you need to raise your hand. Use the raise your hand icon in order to get in the queue, and please don't forget to unmute yourself. I will start by giving the floor to Politico, Ashley Furlong. Ashley, can you hear me?
Thanks, Fadila. Can you hear me?
Very well. Go ahead, please.
Thank you. My question is about the deal announced on Friday between COVAX and Pfizer and BioNTech for 40 million doses of their vaccine. That number seems quite small to me, given the size of the other deals that have already been made for this vaccine. We've seen the EU has reserved 600 million doses. The US has 200 million. I want to know if you could explain that discrepancy. And would you also be able to explain how this sort of limited number of doses will be prioritized across countries participating in the COVAX facility? Thank you.
Thank you, Ashley. Just looking who can answer this question. Dr. Bruce Aylward will take this question.
Thank you very much, Ashley. One of the most important things as the COVAX facility put together its portfolio of vaccines, just like they were put together in, for example, the European Union and other places, was to ensure that you had a diversity of products that you could rely on both today but also in the future. And part of the deal on Friday was to ensure that the COVAX facility also had access to and experience with mRNA vaccines, because the importance that these may have played in the initial rollout in high-income countries in particular, but may also play as we go forward and we look at a need to potentially adapt to vaccines as well. But there's a few things to realize in putting this deal in place, even with relatively small doses of vaccines, because this is a vaccine that we anticipate, because it's already licensed, already in use. We already have recommendations from the World Health Organization on how to use it globally, that this could be launched very, very rapidly and earlier possibly than some of the other products that are currently available. By rolling this out, even in small quantities, there's multiple major advantages. Number one, because you'll remember, Ashley, even in the Western countries, the Pfizer vaccine was rolled out with very small quantities initially. But what that does is it gets the whole system working. It gets your indemnification process in place, your no-fault compensation processes, your cold chain in place, your training in place, all the other things that will be absolutely vital to the products that come before it. The other thing was, even with a relatively small number of doses, and we looked at this quite closely, it was clear that we could make a real difference in protecting some of the most highly exposed, highly at-risk healthcare workers, particularly in some of the AMC countries that the facility serves. And then the other important element of it was, by having a framework agreement in place with Pfizer for this important vaccine, because remember, of all the countries that are currently vaccinated vaccinating, which are over 50 now, more than 45 of those countries are actually using the Pfizer vaccine. And after that, the next one is much, much fewer, down around 6 or 7 countries. So what the other big advantage by putting the framework agreement in place is that we can then open the door to donations in a much more potentially, let's say, seamless manner with other countries that currently have contracts with and substantial quantities of the Pfizer vaccine. So there's multiple advantages from the experience we will get, the learning experience, the protection to this vital health worker infrastructure in low-income countries, which is highly exposed, obviously, opens the door to donations, etc. Now, in terms of where it would be used first, back on the 6th of January, the head of the COVAX facility actually wrote out to all the participating countries, all 190 countries, explained that we would have access, we were negotiating to have access to the Pfizer product, and then invited countries that might like to be part of a very early small-scale rollout as part of, like I said, a learning and risk reduction activity. So we've now received applications from a number of countries that are interested to do that. There's a large readiness assessment ongoing to see who has the infrastructure and requirements in place to be able to use that product. And then over the coming week or week plus, there will be a process then to try and look at what is the best order of countries to roll out the product. So that'll take place through the what's called the allocation mechanism of the COVAX facility. So by starting with this product, an awful lot of learnings, and to really make sure the system can move the larger doses of other products that we expect will come in right behind it in February.
Thank you, Dr.